Today I wanted to talk to you guys about infusion sites for your insulin pump infusion set that you may not have thought of or tried yet. Here I'm showing pictures of the most common places that manufacturers say that you can use your insulin infusion sets. And of course we know that you should also rotate them quite frequently. This next picture shows where I use and many others use on their body sites that you wouldn't normally think to use your infusion sets. Now this next photo I'm doing a close-up of so you can see that you have a lot of area that you can use, and that I have used all of these with the exception of placing my insulin infusion set on my breast. Some people do it, I do not, but some people do it and have great success with it. Also on the bottom of your legs where I have the arrows on the sides, not the front of your legs, but the sides is a great place to use an infusion set as well. On the bottom below your knees, on the sides of your legs. Also on the front of your thighs, even on your inner thigh and the outsides of your thighs are great places because you have a lot of fat or more fat. It's said that anywhere that you can pull up an inch to a half an inch of skin is anywhere you can insert an infusion set. Now some of these places are not going to be suitable for people who wear like the Omnipod 5. And this is because it would just be too bulky and uncomfortable. But with other infusion sets that are flat, mostly the ones that are tubed, should work great in all of these areas. Now we're going to take a close-up look at the back of the body. And here you find that you have a lot more areas as well. The back of your legs below your knees, your thighs, your inner thighs, your outer thighs, the outside of the back of your legs, right there on the back above your bone, on the sides of your body right there, the sides of your stomach, which of course you can go all the way around to your stomach. Right, if you reach under your arm, back there under where your arm would hit under your armpit, you have a lot of skin there that you can do. Just be careful around those areas and under your chest because of your ribs, things like that. Remember, you can insert an infusion set on the back of your arms, on the front of your arms, under your arms, on your shoulders. These are places that are really good and help you to rotate your sites. That's something that I'm going to talk about and discuss a little bit about the importance of moving your sites and moving them often, and what happens if you do not. And just know that you can try a lot of other places on your body to see if they work for you. Some may work really well and you find that some don't, or that places will hurt more where others say that they don't. And it just has to do with the makeup of your body and your skin and things like that. So don't be discouraged, but you do have more options where to put your actual infusion set and your CGM. Now I want to talk to you about something called Lipohypertrophy. This involves a lump of fatty tissue right under your skin. It may feel like lumpy, it could feel firm, even hard sometimes, and sometimes it can feel numb. It's really common in diabetics who require multiple injections, infusion sites, things like that. It actually affects over 64% of diabetics who take actual injections for insulin or through insulin pump sites. The things that can increase your risk factor for getting this fatty scar tissue is if you have a low BMI, you don't rotate your injection or infusion sites regularly enough. And if you use human insulin instead of analog, which is laboratory created insulin, or if you continually reuse needles, and those are the risk that can cause, it's like the perfect storm for getting this scar tissue. Okay, now having these lumps and scar tissue and things like that can really, really affect your diabetes, because it can keep you from absorbing your insulin completely, or you won't absorb a lot of it, that you inject, and it may require you to have a higher dose of insulin where you normally wouldn't, and it can either cause you to, have high blood sugar, low blood sugar, because then it could actually cause you to, on the low blood sugar side, you think, it's not absorbing, and it's not really, and then you take another shot, and then finally, although it's slowly absorbing, it does, and then it lowers your blood sugar. It's said that a lot of people, because sometimes these sites are numb, or somewhat numbing, like to continue to use those sites to reduce on injection pain or infusion site pain. But the problem is that just makes it worse. And while those lumps don't spread to other parts of the body unless you're injecting in those sites, those spots can become bigger, lumpier, harder, and they don't work as well. You'll find, you think, well, my gosh, this spot of my arm always works. This works so well. I don't know why my my blood sugar is going high. Well, it's probably because you use that site all the time, even if it is with your CGM, because even though you're not necessarily getting an injection with it, you are puncturing the skin, and you have a catheter still in your body. And you'll find that those lumps may not be quite as big, but it also will stop your CGM from being able to accurately assess your blood sugar. Okay, and early detection is the key to treating and possibly reversing this condition. You should always check your sites before you insert your needle or your infusion set, to see how it looks. Does it look red? Does it look puffy? Is it irritated? Do you see a lot of scars there? And you should also talk to your healthcare provider and have them inspect it, because that's really one of the ways to figure out, especially for the healthcare provider, if you do have scar tissue built up, and they'll look at it, press on it, see how it feels, and things like that, and compare it to other parts of your body, to see the change in the skin. And also, the way you treat it is that if you notice it, or realize that there's scar tissue built up, you will stop giving shots in that area immediately for at least 3 months, so that area can heal and possibly go down and go back to normal. There's also, if it's really severe case, is to you can have liposuction to remove the fatty tissue in there as well. Now, something I like to do after every CGM insertion, is to, once I take it off, and my insulin pump sites, I always put a little bit of antibiotic, clean it really well, and put a little bit of antibiotic ointment or cream on there. So to help it heal. I found that helps tremendously with scar tissue as well, and I try to avoid that area as much as possible. And in the beginning of this video, that's why I was showing you all these different areas in which you can that you do have that you can try, to put your infusion sites. Some of those spots, I don't know if I would take a shot in. Just me personally, because of how I think it would feel, I don't know. But infusion sites, I'd be more apt to try and have tried the majority of these sites, like I said, except for the ones where in your chest, your breast. Some people do that. I cannot, and it is a hormone. So for me, to me, that's just a big risk factor. Although I don't know if there's any studies showing, this is just my personal opinion. It is even if it's a synthetic hormone, it is a hormone that you are shooting into your breast, and I don't want breast cancer, so, and I don't want my boobs to be lumpy or any lumpier than they are. So, and I just can't imagine. I mean, I treat my breasts like men treat their balls. They're sensitive, and I don't want to upset them or anything, But anyway, okay, and here again are ways, I'm just going to repeat, ways for you to try to avoid the risk of getting these scar tissue lumps, fatty spots, is you change your injection site every time, and you change your infusion pump site every 3 days. That will drastically help a great deal. You check yourself every time before you inject yourself with a shot or you put a new infusion set on, to make sure that you don't see any spots. When you go to your doctor or your healthcare provider, have them check out your skin. Even though you've done it, they may notice something that you don't notice. It happens, and you may notice something that they haven't noticed. So for you to talk is like one of the best things you can do. You space out your injections, like at least if you're taking injections, at least a finger width apart. Okay, and if you're using an infusion set, it's 3 finger widths apart. So 1, 3. And you can use, I used to do this before I got an app or a thing. You can get an app, I believe, this to put where each time you change your infusion site or whatever. But I actually printed out a piece of paper that had the front and back outline of a body, and I would mark each time where I did it for the month or the whatever, and so that way I would know where to do it. I also will, if I have started on this side, I will go like this and then come down and go like this, and then I found though the inside here is very tender for me. It's like virgin skin. I rarely put them in just right like this, actually, like right there. I'll do it, but I don't like to do it. But underneath and stuff. But I actually have a spot right there, and it is it's not numb. I will tell you that at all. And I've had it checked out because not all lumps are caused from, you don't know, so you want to get it checked out, and it is definitely a fatty lump. And so it's caused because I put my, I'll go all up in here too, but I can't put it in there anymore. And I haven't put anything in here in probably 2 years, and the lump is still there. It can literally take months or years for those spots to go away. Depending on how many times you've used them, how severe it is, and you literally can't. If you want it to go away, and not have to go have liposuction or have it cut out, blah, 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 whatever, you cannot put a infusion site or inject insulin with a needle through that at all. You just can't do it, or they will not go away. So, and they can come back. So, and it can come in another area if you decide you start doing that. And I found that it was too hard for me to, or it was just, I don't know, hard being the word, but inconvenient or just whatever to keep, like put one over here, put one on this side the next time, then down here and then here. So I'll do one whole arm or whatever, and I even put it here, like on the spots. Like if y'all show, I will put it here. I will put in fusion sets here. I used to put my Omnipod and Omnipod 5 right here all the time. So I definitely would do that because it's a lot of, now it is, like I like to say, it feels virgin-y skin. It can be. And I would put right here, sometimes I would put my CGM. I will put my CGM here. Sometimes it just depends. But for the most part, I really love my legs. I used to not, but I love to put my infusion sites in my legs. And mostly my upper thighs and stuff like that. So, but I switch out and I like to put it in my back, my sides, up here, like right here is a good spot if you can. I mean, actually have a lot of tight skin right there, so sometimes it will hurt. I mean, you know, and like right there, that is, I love to put it right there. I know it sounds funny. I love to put it right there. But anyway, so, but you need to, the key to all of this is you need to rotate, treat, clean very well, you know, and know that if, you know, they can become infected. These spots can become infected and become a problem too. Like if you notice that it is, what, hot or warm to the touch, red, bruised, real painful, that's when you need to seek medical attention right away because it could be infected. And and it can cause, I'll put some pictures in here, it can cause ugly, like ugly, really raised red infection looking. I mean, it's, you know, after a while those spots may not go away, you know. Up to a point they are reversible as far as without having to go in with lipos, and it can also cause other problems. So the key is, and I know we all have our favorite spots that we like to, you know, put our infusion sets, our CGMs, but we need to rotate if we want to be able to control our diabetes better, you know. And so I hope this was informative. I just wanted to come on and share this with you. Again, I'll be placing some pictures in here of some of the sites that have gone a little way too far, you know, and lots of times it's the stomach, because the stomach, once you get over the fact of taking a shot in your stomach, you know, I was terrified as a child. That was always, I mean, I just couldn't bring myself to do it. And then finally, once I did it, I was like, yay, this is good. But I don't really care to put my infusion set in my stomach. I prefer it in my arm or my legs. I mean, I have it in my arm this time, but I just had it in my stomach right here. You know, before I just put it in my arm. So I don't particularly care for my infusion sets in my stomach. But I loved a shot in my stomach. I couldn't stand a shot in my leg, but I like my infusion sites in my leg. It's just weird, and it's a preference, and you have to know where your clothes hit, where it's going to rub, where you may sit down, where you may yank that sucker out, you know, that kind of thing. So, but again, I do hope this was a little bit informative, and it gave you some ideas of maybe where you never thought you would put an infusion set and why it's so important to switch your sites out, and give, you know, if you do it right, you can give 1 month to rest, a side of your entire body to rest, if you do it properly and space out, you know. So, and that's how I would do it. I would go one side of my body, down my body, you know, and then the other side of my body, and then maybe in the center, you know, and give each of these places, and actually you can give them a couple 2 months almost, you know, if you do it right, space out your spots, you know, and everything. So anyway, just check yourself out. You know your body better than anybody does, and communicate with your doctor about everything.
even if you don't think they're going to like what you're going to say or what you're going to tell them, and you don't like what you're going to tell them, just communicate with them, you know. So he who was without sin cast the first stone. So the doctor can suck it. I'm pretty sure he's doing some unhealthy things of his own, but as long as you're being honest with him, he can help you the best of his ability. So I wish you guys all the best. I hope y'all are enjoying life. Remember, pick one thing today to be happy about. One thing. If you're having a bad day, just pick one thing and focus on that. Laugh, y'all. Be sarcastic. Remember, don't take life too seriously. Nobody ever makes it out alive. And as always, be the reason somebody gets drunk today. I will talk to you guys later. Bye.